I am Edward L. Kadunk, President of the Pan American Health and Education Foundation. Today I'm speaking with Sue Patterson, founder of the Women's International Network for Guatemalan Solutions, WINGS, which has been selected to receive the 2011 Clarence H. Award for Excellence in Voluntary Service in recognition for its commitment to reproductive health and the unwavering dedication of its volunteers. Created in 1989, the Clarence H. Award for Excellence for Voluntary Service recognizes the work of the voluntary non-governmental sector in improving the lives of the peoples of the Americas and advancing the public health sector. Mr. Clarence H. Moore was the chief of the PAHO Office of Budget and Finance from 1957 to 1968, and the Pan American Health and Education Foundation's executive director from its founding in 1968 until his death in 1988. The award is one of 6 in the Pan American Health Organization, Pan American Health and Education Foundation Awards for Excellence in Inter-American Public Health Program, which was established in 1975. Recognizing the dynamic and diverse population of Guatemala, how has WINGS been able to overcome the challenges related to culture and religion when addressing family planning and reproductive health?
One of WING's core values is to respect the cultural and religious orientation of the people that we serve, which are underserved, usually remote Guatemalans. So many of them are Catholics, and many of them are traditional Mayan people. We do try to use these as assets rather than obstacles. It's not always easy, but in all of our education about family planning, we talk about both modern contraceptive methods and natural methods, because many of our listeners prefer the natural methods. On our staff, we also seek to have as many Mayan speakers as we can. In Guatemala, there's still 22 Mayan languages spoken. I'm proud to say that we now can deliver this educational information in 6 Mayan languages. It's not been easy to find Mayan speakers who are willing to talk about family planning because it's such a taboo subject. But we also deliver these messages in Mayan languages on in radio spots and in trying to overcome all the obstacles that there might be for them to understand them. We always reach out as best we can to religious leaders and try to incorporate them into whatever talks they are willing for us to do. If they're Catholics, sometimes they're willing for us to come talk about natural methods. If they're evangelicals, sometimes it's their youth groups, sometimes it's their about-to-be-married groups, and so we do as well try to incorporate religious leaders.
Considering the traditional role of men and women in Guatemalan society, how has the inclusion of men in family planning and reproductive health education, access, and advocacy furthered WING's mission in Guatemala?
Well, as in many countries, men are the main decision makers on all issues having to do with the family, which includes family planning. But at the same time, they're often overlooked in receiving healthcare services and in receiving education. Several years ago, maybe 8 years ago, we did a barrier analysis study to find out the various obstacles that we were facing in getting people to adopt any contraceptive method that they chose to use. And of course, one of them was the macho culture in Guatemala, and the men have a lot of misinformation and a lot of fears. At that time, we decided to begin a special program targeted at men, and WINGS was the first organization in Guatemala to create a special program for men. This program works with peer counseling, and we also have a mass media campaign, and we're trying to reach men wherever they are. Sometimes it's Alcoholics Anonymous, or on the buses we have spots mixed in with music that we play on public buses. And our men's program has really been an important component of Wings. It's really not fair to expect men to be well-informed and supportive partners if they haven't been able to receive the education and moral support that they need. So we are working really hard to help make them better, more collaborative and comprehensive of their wives.
Very interesting. As you know, the role of volunteers for organizations like Wings is extremely important to the organization's success and impact. How do you establish, cultivate, and sustain your pool of volunteers, including keeping them motivated and identified with your mission?
We rely heavily on volunteers because our staff is not very large, and so we can leverage our impact a lot using volunteers. Both our men's program that I just discussed and our youth program rely very heavily on peer education. So in that capacity, we are working with men and or adolescents to provide them the educational tools that they need to be able to talk well about this subject, and also improving their leadership and presentation skills. We've trained well over 600, I think it's close to 700 young adolescent peer educators who are reaching an enormous number of people, because it's so much easier as it was for us when we were young people, to get information from our peers than to go to our parents to seek that. And it's easier for men as well not to show their ignorance by necessarily going to a public health facility. And so we rely to a great extent on those as extensions of our staff. In another fashion, we have usually American or Mexican Masters in Public Health students who come down as summer interns to do evaluation programs, and they become effective ambassadors for Wings when they go back home. Regarding the question of keeping them motivated, this subject is so compelling and so necessary in Guatemala. Guatemala has the highest birth rate in Latin America, and the population is just growing pell-mell. So the subject matter and the need of the people, when our volunteers get out to these rural areas and see a woman with 8 or 10 children, they stay motivated. It's not always easy to keep volunteers motivated if they're working in the office doing data entry, and we do get some wonderful help that way as well. But our paid staff is so committed to our mission, and so that generally permeates through the volunteer groups as well.
Well, thank you very much. That was very interesting. And thank you for representing Wings today in recognition of the organization's important contribution to improving the lives of Guatemalan families by providing them with education, access, and advocacy in family planning, reproductive health, and other health programs and services. And congratulations to Wings for winning the Clarence H. Moore Award for Excellence in Voluntary Service.
Thank you very much. It's been a great honor and a very exciting week for me to be here. Thank you.